I am registered with an NHS GP. I have used independent healthcare in the past. I'll answer her question. I am registered with NHS GP. I have used independent healthcare in the past, and I'm also grateful to the Friarage Hospital for the fantastic care they've given my family over the years. But the truth is, Mr. Speaker, I'm proud to come from an NHS family, and that's why I'm passionately committed to protecting it with more funding, more doctors and nurses, and a clear plan to cut the waiting list.
If the Prime Minister had negotiated with the nurses before Christmas, they wouldn't be on strike. If he'd negotiated with the ambulance workers, they wouldn't be on strike either. So why is he choosing to prolong the misery rather than end these strikes?
Mr. Speaker, we've always been clear that we want to have constructive dialogue with the unions. That is also why, when it comes to the issue of pay, we have accepted in full the independent recommendations of the pay review bodies. But now, the honourable gentleman simply doesn't have a policy when it comes to this question. If he wants, he talks about wanting to end the strikes. The question for him is simple then. Why does he not support our minimum safety legislation? We all know why. We all know why, Mr. Speaker. It's because he's on the side of his union paymasters, not patients.
Mr. Speaker, when I clapped nurses, I meant it. His response to the greatest crisis in the history of the NHS is to threaten to sack our nurses. His Transport Secretary says it's not the solution. His Education Secretary hopes it won't apply in schools. His own assessments say it could increase the number of strikes. The simple truth is you can't legislate your way out of 13 years of failure.